Hey guys, and welcome back to the You Know the Drill podcast, the podcast hosted by me, Faris, and my mate Robbie, two fourth year dental students providing dental content for all your needs. Whether you're a dental student or applicant, if you want to learn more about the reality of dentistry, this is the podcast for you. If you want to keep up to date with all our updates, episodes, and more, make sure you follow us on Spotify at You Know the Drill podcast, and don't forget to check out our Instagram, TikTok, and YouTube. Thank you.
So today we are joined by the legend himself, Dr. Zain Rizvi. In this episode, Zain will tell us a little bit about his accomplishments during and after dental school, and also give us some tips on how to really excel during your undergraduate years and in your training year following graduation. So without further ado, welcome to the podcast, Zain.
Thank you for having me, guys.
Yes, very, very exciting. I think this is going to be a really fun one because just kind of looking at your Instagram, your socials, this is how I actually got in contact with Zain, was just seeing the quality of work that you produced like so early, like out of dental school, is really inspiring to see. Especially because I'm pretty sure, you've probably seen a lot of dental students on Instagram. We're kind of just trying to do stuff and we're like, doesn't look that great. So it's nice to see that, it gets better. So just as a little introduction for our listeners, can you just tell us a little bit about yourself?
Yeah, so my name's Zain. I basically am, I graduated from King's in 2020. I was actually a graduate entry student, so I joined in 2016 in BDS2, kind of ran through the normal sort of curriculum, graduated 2020 in the middle of COVID. That was interesting, and you guys, I'm sure, and people who listen to your podcast can relate to kind of how disruptive all of that was. And over COVID, I went into DFT as well, so that kind of disruption carried forward into DFT. But I had a great time. That's kind of where I started really getting into my Instagram page, and I think posting more clinical stuff, because obviously at uni you can't really post much more than phantom head stuff.
Yeah.
Which I was also doing actually when I started the page, and we can talk about that later. And then I finished DFT kind of last September, and I've been fortunate to get a job in Greenwich in private practice. So I've been there since September, just kind of honing my skills really. It's nice of you guys to say, that you like the work and stuff, but just like you guys, I'm also learning from people older than me and more experienced than me. So to be honest, it's all relative in terms of what you look to and you're like, wow, like that's amazing. So yeah.
Perfect. All right. So just diving straight in then. So what were some of the things that you were doing to really make the most out of your time in dental school?
Yeah. So I always view like dental school for me in like two parts. And I think the kind of first year and a half, so BDS2 and most of BDS3, obviously that's very theory orientated, and a lot of your kind of day-to-day is kind of revising for exams and tests and learning kind of actual didactic content.
Yeah.
So in terms of making the most of that, I just used to kind of follow the kind of strategy that I had when I did my undergrad in biomed, which was just like, turn up to lectures, make some notes. And then one thing I've always done throughout my whole sort of life is that instead of leaving work to just pile up like most students do and then hit Easter break really hard and cram, I used to always be like, look, I'm not someone who can do all these like 12-hour revision shifts and late nights and stuff. So what I'm going to do is I'm going to go to lectures, make brief notes, and then at the end of each day, because I'll probably have only sat through maybe 2-3 lectures in the day, at the end of each day, I'll just kind of look through the lectures, even if I'm just reading through what was covered, and just try and make sense of it in my head. And if I can, make some quick notes on that topic. And then that way you start to build up kind of your notes so that when it comes to Easter, you don't have to go back to lecture one that you had in October time and like literally go through the whole lecture again. You can kind of just look at the quick notes that you made on that day after reviewing the lecture. And so basically it's all about just kind of making notes and then remaking those notes and rereading. And it's just repetitive, right? That's how you memorize and learn stuff. So I think I just kind of saved myself that initial like, oh my God, I've got so much stuff to get through, because I'd be like, oh, I've kind of been doing it as I'm going along. And doing small bits every day is a lot more manageable and less stressful. And you can still have a great uni life doing that than leaving it all till Easter and just having a breakdown. So that was a kind of pre-clinical. Post-clinical, like from third year, fourth year, fifth year, for me, it was a couple of things. The main thing was 10,000 hours concept. So I was like, look, like the only way I'm going to get good at this hands-on career is if I actually just put the hours in and I literally train my hands to do what I want them to do. I think a lot of you guys at dental school, you actually know what to do, and you're probably more clued up than most dentists who are 10, 15, 20 years qualified, because you're learning the most up-to-date stuff about bonding, about composites, about prepping, whatever. generally speaking. And so you have the knowledge. It's just that your hands don't do what your mind wants them to do, and you kind of make mistakes and you learn from them. So I was just like, right, it's just like any kind of sport that you play. Like the more you train, the better you're going to get. But you have to put those hours in, and there's no real shortcut. So my biggest advice, and I always talk about this, is that if your patient doesn't rock up at dental school, or you don't have a patient, and before COVID, this was a lot rare. It was a lot more rarer for people to bring phantom heads up and start doing practice, because most people, if their patient didn't show up or they didn't have a patient booked, then they'd just go home or go out with their friends, and they'd have like a half day and they'd be chilling. For me, I was like, okay, 9 to 5, I'm meant to be at dental school. I'm paying to be at dental school. It's a bit of a grad mentality because it's your second degree, so you're kind of more focused on what you're doing. And so I was like, 9 to 5, if my patient doesn't show up, I'm going down to floor 20 and I'm getting a phantom head, and I'm gonna either do a prep, a composite, whatever I see on Instagram. I'm just gonna practice that. And I'll take photos of it if I want to post to my Instagram and just reflect and ask people for advice. But the photos thing didn't really matter to me as much, because I did loads of times where I didn't take any photos of anything and I didn't post them anywhere. But I just kind of wanted to prep and just get used to my hand preparing for crowns and stuff. And I did that literally from midway through third year until fifth year. And if you think about it, like every week you've got 3 or 4 clinical sections, more as you get into fifth year. And during third and fourth year, you actually have the time to be practicing on phantom head. And like I said this on a different podcast the other day. I was like literally doing full mouth rehabs on phantom teeth. And you know, they might still have this rule in place, but when I was there, they had to introduce a rule which was like 2 teeth and that's it for the day. And it's because of, I don't know if it's because of me, but like I was going through like tons and tons of teeth because I was just practicing. And that for me clinically got me to where I think I have developed to in terms of FD and now first year associate. Like I don't think I'm some prodigy or I'm talented or anything like that. I don't even think my work is necessarily the best out there either. But I do think that the things that I find easy, I only find easy because I've done them for hours and hours and hours. And that is probably the biggest piece of advice I can give you, because everyone can do that. It's just about putting the work and the hours in, instead of kind of just taking the afternoon off.
You know, that's very interesting. I remember again when I messaged Zain, I was like, "How do I make the most out of dental school?" And it was like, just do more phantom head work. And you know, I'll be honest, I'll put my hands up and say, sometimes when a patient doesn't come in, I'm like, you know, take some time off. But this is a very logical thing. Like, you're not saying anything that's abnormal or wrong. It's just if you put more time into it. And I think, you know, we do have the resources at dental school to actually, you know, practice more and improve our preps. It will allow you to be a lot better. Like, I think even myself and Robbie, Zain, if you remember, like in third year, you start doing like crown preps. And I remember, if I look at my first crown prep, wow, it's an interesting shape. Let's just say that, like, and only through sheer repetition, like, because as I said, like, we've got the knowledge in our heads, but actually getting your hands to do what's in your mind is very challenging. So yeah, I think I do back the idea of putting the time in, using those phantom heads, and dental students, you know, listen to it. Don't just go home. Very, very interesting. And you also did some other things while you were at dental school. So obviously, you know, you were doing dentistry as a graduate, but you also did a few other things alongside it. What can you tell us a little bit about, you know, what you were doing alongside just a degree?
So I did stuff around dentistry and outside of dentistry as well. So it depends kind of where you want to go with it. Do you mean kind of specifically clinical and around dentistry, or do you mean completely like outside of dentistry?
Any sort of extracurricular things that you did that took up your time, basically?
Yeah. So let's talk non-clinical first. So like I've always been really big into my sport. So I really, really love cricket. I've been playing it since I was like 7. I've played it to quite a high standard. And at uni, that was always a thing that kind of, I made a lot of friends playing cricket, and that's how I know a lot of the people that I do know at King's, just through sport. So I did a lot of that, met a lot of great guys through GKT cricket. And then I've always had like ambitions and aspirations and interests in like politics, current affairs, kind of journalism. That was the kind of stuff that at school I was like wanting to do. And then, you know, Asian parents, and also just looking at kind of science and where you can actually go with it as a career. There was a lot more of a predictable career pathway with science than there was with English lit at uni. And that wasn't parental pressure. That was just me looking at the two options of being like, yeah, I can see an easy pathway into dentistry here. Whereas with English, you know, I'm going to have to graft the network and do all these things. And basically, I'm going to have to wait for a lucky break to go into like politics or journalism. So one really big thing that I did when I was at King's was I enrolled on this it was called the Young Muslim Leadership Program, but it wasn't about Islam in terms of like learning about faith, and it wasn't like a religious sort of camp. It was actually about enabling young Muslims to partake in sectors where they're traditionally underrepresented. So in politics, in media, in the arts and drama and TV and that sort of stuff, because you don't really see ethnic minorities and also people from Muslim backgrounds in those sectors normally. So it was all about kind of enabling young Muslims to kind of branch into those sectors. So it was like a 2-week sort of camp at Oxford University as part of they have like an Islamic institute there, and that was crazy. Like I signed up for it on a whim, and I applied, and they accepted my application, and I went there for 2 weeks residential, I think over summer, and I met so many great people like MPs, the CEO of Oxfam, like really interesting people that you just wouldn't come across in your normal day-to-day life. And a lot of it was just conversations, discussions, tea and coffee with these people, and just talking to them like about anything and everything. Like when you're curious, you can just you can ask them anything, and they'll be happy to discuss it. It's just having access to these people. And basically, off the back of that, loads of things came out in terms of like initiatives that I then pursued. But the biggest one was the number 10 Downing Street thing, and we can go into that in a bit more detail. But all of these things, it's kind of putting yourself in the right place at the right time. That was like the thing that I learned the most from it. I'm someone who's always said yes to stuff more than I've said no. Like if someone comes to me with a proposal or an idea, I'm always like, yeah, go on then, let's try it, or let's do it. I'm never like, nah, that sounds like a rubbish idea. Like I always want to try, and then yeah, okay, if it backfires or it's not very good, then fine, I've wasted a bit of time and maybe money. But I'm always open to like starting something new or exploring something new or collaborating with people, because you don't know what can come with it. It is like that kind of butterfly effect that they talk about, where like one thing leads to another, and you don't actually know how you ended up on this podcast, for example. But maybe it was something that you did years ago that set things in motion for you to have the success that you now enjoy.
Yeah, no, fair enough. Okay, and then something else that you've done since graduating was publishing a book. So I'm going to ask you 3 questions all in one. What's the name of the book? What is it about, and where can people find it?
Okay, so the book was it was a lockdown project, and it was based on kind of, I guess, similar to what you guys are doing, in that I wanted to help a lot of like young dental students and people younger than me who'd like be DMing me and asking me for like tips or tricks or advice about dental school particularly, and how I'd done, won awards and that sort of thing. So that's why I put the book together, and I just started to set myself the target of like writing 500-ish words a day over lockdown, because everyone had the time. And so I was like, all right, let me do this every day for a month and see what I've got. And at the end of it, I had like 100 pages worth of writing, and like it was easy because it was like me giving out advice. So obviously we love hearing ourselves talk, and so writing's the same. You don't struggle to hit 500 words when you're writing about something that you genuinely believe in. Whereas when it's like a literature review, you're like, oh god, 500 words, how am I going to do that? So the book's called Know the Drill, which is like your namesake on the podcast. Obviously a good pun for dentists. And it's about basically giving advice to dental students. So it covers lots of different areas. It covers kind of clinical tips and tricks, which obviously is now kind of my more mainstay and the kind of stuff that I talk to most people about now. But back then it was just like a chapter in the book. Then it was stuff like networking, passing exams, how to like apply for awards. So, you guys always get emailed about, oh, we've got this award coming up, this essay competition, this clinical skills competition. And so it was like there was advice on how to approach those so that you've got the best chance of winning. So there's a big chapter and big series on that. And yeah, networking. So like how I've met some dentists, how I shadowed some dentists, how I learned things. Like it's all about kind of exposing yourself to lots of different influences and content out there. And to a certain extent, a lot of you do it already, but there's potentially avenues that you might not be aware of. And so that book was just kind of covering all of those possible avenues that I'd been exposed to, so that other people could benefit from it. And it was self-published on Amazon.co.uk. So if you go on Amazon, type in Know the Drill, you should be able to find it there. And it's all the proceeds go to charity. So I don't make any money off of it.
Wow, that's amazing. Yeah.
Excellent.
So what advice would you give to anyone thinking of, writing a book quite early on in their career like you've done?
2 things. Number one, I think we all suffer from this so much, and I think it's such a shame because it stops us from really contributing value. And that is, don't have imposter syndrome, like try to drop the whole like, oh, what do I know? I'm only second year BDS, or I'm only I'm only a student, or for me, I'm only a first year dentist. What do I know? Like you should just drop that kind of ego trip where you're like, oh God, I don't know enough. Like you should just realize that everyone on this planet has some sort of value to offer. And your advice doesn't always have to be perfect. There's a lot of stuff that I might advise, tips and tricks wise, that may not even be clinically perfect. Like, there might be flaws in it. And I might realize that 10 years down the line. You have people like Tiff Qureshi posting 20-year follow-ups on Instagram. But a lot of the stuff that he's learned has been over time. Like, he's posting 20-year follow-ups. And only now is he like, I know that this stuff works because I've got 20-year follow-up. But when he was doing this 20 years ago, he probably thought, I think this is a good idea, but will it work? I don't know. And so like things evolve with time. So don't be afraid of making mistakes or giving the wrong advice, because other people are also smart. Like, I'm not, you guys are all really intelligent students and you can critique stuff. So like if you get a piece of advice from me that you think, oh, that doesn't really make much sense, then you won't take it. Like it doesn't matter that everything isn't perfect that you're putting out there. Just get it out there in the first place and then refine it. I think a lot of us just stop ourselves from putting anything out there because we're like, oh, like what if it's not perfect? Like, we're perfectionists. And if you kind of get paralyzed by that, you'll never put anything out there and you'll never benefit from it. So my first piece of advice is just kind of get over that self-esteem kind of imposter syndrome issue and back yourself to put something out there that is of value. And don't be afraid of like, if it backfires or if someone critiques it. There's always people out there who are going to give you criticism. And then the second piece of advice is, in terms of the actual specifics to writing a book, don't view it as like, oh God, I've got to write a book. Like, how the hell am I going to put together hundreds of pages? Just be like, what is it that I want to say? And how do I want to structure it? So the way you'd write an essay, be like, okay, this is what I want to cover. I'm going to structure it in this way. So these are going to be my chapters. So for me, I was like, okay, I want to cover mentoring. I want to cover clinical tips. I want to cover awards. I want to cover, networking and all this sort of stuff. So those are my chapter titles. And then for each chapter, I was like, okay, I'm going to just start with number 1, which is the introduction or applying for awards. And I would just write. And I never put any pressure on myself to hit a certain amount to write for each chapter. I was like, I'm going to say what I think is important for this topic, and I'm going to leave it at that. I'm not just going to waffle to make it sound like it's lengthy, because that means that the actual content will lose value, because people will be reading absolute rubbish, being like, what's he trying to say here? So I was very like to the point and concise, even though when you think about it, it's a bit counterintuitive because you're trying to fill out this book that you want to publish. But even if your book is, I read something which is like, even if your book is like 40 pages long, that's still an achievement and that's still a publication. Like, it doesn't have to be hundreds and hundreds of pages like novels. It doesn't have to be like Harry Potter. You don't need to have 7 series and 7 editions. It can even be, I was thinking, all right, I'm going to make a 60-page book. Ideally, that's how much content I've got there. And just because I took that pressure off myself, I ended up having 101 or 108 pages. And that was just kind of like, oh, okay, wow, I put together something quite substantial here. But don't intimidate yourself at the first hurdle. Just get started and keep writing. And then when you think you've said enough on a topic, move on to the next one.
Okay.
Yeah. I think, I don't know, I'm definitely misquoting this, but it was something along the lines of, if you're teaching something, don't try and teach it like a master, teach it like a student. So as if like it's stuff that you've learned along the way, rather than you trying to talk at someone and be like, oh no, I know that these are the best tips for, composite XYZ.
Yeah.
And I think that kind of, helps with the imposter syndrome, because sometimes you do think, okay, I know this, and I think I know a little bit more than like the average, but I'm not a master. So yeah, just a way to like think of things.
Yeah.
But yeah, just in general, like, what tips would you give to those who need some inspiration or advice on how to like maximize their time in dental school?
Yeah, I think I remember sitting down actually quite distinctly, I think in 3rd year, and I was like, I think on a blank piece of paper, I put down like, what do I actually want to achieve in like the next 5-10 years? Because we've all got different priorities. Like, for me, clearly at the moment, my priority is like, I want to be the best dentist in the world. Like it sounds lofty, but that is like, for me, if I was to write down my single goal right now, it's to become the best clinical dentist out there. But some people don't care about that. Some people are like, oh, as long as I can just like make sure things are okay for a patient, I want to be more like popular or an influencer. I want to be a denfluencer, whatever you call it nowadays. And that's not something to look down upon. I just don't have any interest in necessarily being that kind of person, but it's not a bad thing. Like, some people are geared up and gearing their social media and their profile up to be influencers. And that's totally fine. But if that's your goal, then you're going to be doing things a bit differently to what I might be doing right now. So my first piece of advice would be just sit down and just kind of have a think. Okay, in 5 years, where do I want to be? In 10 years, where do I want to be? And then at least you have a little bit of trajectory. And you don't have to be very specific. You don't have to overthink it. You just have to be like, right, where do I want to be? And then once you've got this kind of objective, the story that you want to tell yourself, then you can start planning towards how you might get there. So like for me, it was like, okay, I want to be the best clinically. So how am I going to do that? I'm going to put in hours of practice at university on phantom head. I'm going to surround myself and shadow and observe clinicians that I really respect and admire. So, I'd go shadow on Harley Street. I'd email these people, and most of them would be like, yeah, come. I mean, with COVID, it's a little bit difficult because of infection control and stuff now, but you'd be surprised. Like, you should just reach out to these people, and more than often than not, they're happy to either get you into their clinic, show you around, or even just have a coffee or a chat over the phone. So don't be afraid of reaching out to people that you look up to, because that's what we all do. I look up to people like Karai, like Basil Mizrahi, like really excellent clinical dentists, and I want to be more like them. And so that's what I'm gearing myself up towards and taking steps to do that. So it's difficult to give specific advice without knowing exactly what your goal is, but I think the first step is to identify what your goals are, and then you can start to approach the right kind of people. I might not be the right kind of person for someone who wants to be an influencer on social media, or run a podcast, for example. I don't have one. I don't have that kind of content that I'm creating. So I would say sit down and just map out what your goals are, and then you can start putting in kind of plans towards that.
Yeah. We've heard quite a few of our guests say that, actually. So yeah, have a long-term goal and then, work towards that. But yeah, okay, so moving on. So you were invited to number 10 Downing Street for a Prime Minister's reception as recognition for your work. So could you tell us a bit more about how that, came about and your experience of it?
Yeah, so basically this leadership program that I went in Oxford, on the final day, and I didn't know this at the time, but one of the civil servants from number 10. So number 10 is just basically a massive office full of lots of different civil servants working in different departments. So this lady was from the policy making unit. So, they would be advising Theresa May in terms of new policies to introduce for government. So she came down and she was just like, oh yeah, hi, like I work for the civil service. She was very non-specific, obviously didn't say, oh yeah, I'm at number 10 Downing Street and I work for Theresa May. She was just like, oh, I'm in the civil service. I work on various policy initiatives. And she kind of just quietly sat in on a lot of the meetings that we were having. And we started having meetings on stuff like healthcare, infrastructure, education, and like what our views on that were. And I'm not someone who like, contrary to what people might think, I don't dominate a conversation usually. Like I'm quite like, I'll just say what I think if I'm prompted, or if I disagree with something, but I won't kind of just be the loudest person in the room constantly talking and that sort of thing. So I piped up a few times because I was like, well, I'm in this room for a reason. Let me say what I think on healthcare, infrastructure, students, whatever. And then off the back of that, she kind of was like, oh, Zain, like, what's your email? She kind of took down a few contact details, which again, I didn't think was very strange because that whole 2 weeks we were doing that kind of thing, passing around business cards, networking. And I got an email shortly after being like, oh, Zain, like, was wondering if you just want to come down for a chat to number 10. And I was like number 10 Downing Street. She's like, yeah, like, I'm based in the cabinet office there. And I was like, oh, this is so cool. Like, I'm going to go to number 10. I was like, yeah, hell yeah, I'm coming. And I went, and it was like being a tourist. Like you literally take the photos outside the front door. You go in and you're like, oh my God, like you get a tour around the place. And I was like, this is like a movie. Like, honestly, it's so cool. And there was like absolutely no chat about anything serious. We were just I was just being shown around by this lady, and she was like, yeah, so this is this room, this is that room. We went for a coffee in the canteen. And then she was like, right, kind of see you later, bye. And it kind of just finished. And I was like, that was really random. Like, I got a tour around Downing Street, and that's great. I got pictures I can post on my social media, but like, why did that happen? Like, it makes no sense. Like, what does she want? And then there was like radio silence for a couple of months. Then I got a second email, and like a few months later being like, so Zain, it was lovely to meet a few months ago. We're now putting together a roundtable of not just students, but basically focus groups of people that we want to consult about policies that we're thinking of introducing that might affect students, young Muslims, people from your background, basically, and your demographic. So would you be interested in being a part of these focus groups? They'll all be taking place at number 10 Downing Street. And I was like, obviously, yes. And so I had about a series of like 6 to 10 6 to 8 meetings at Downing Street over third year. So constantly throughout third year, I was like finishing clinics at like 4 and just like pegging it down to Westminster and going into 10 Downing Street and having these meetings in all the different rooms of state. It was really crazy, and I was like, I can't believe this is happening. Yeah. I wasn't allowed to tell anyone about it at the time as well, so I kept it very under wraps, because you can't just be like the student who's just going to Downing Street and telling everyone about what you're doing. Obviously now it's all kind of tapered off and I'm no longer involved, so it's a bit more comfortable talking about it.
Yeah.
And yeah, that's kind of what I did in third year. And then what basically happened was there was a change of government. Theresa May went, Boris Johnson came in. Obviously staffing changes as well. People rotate to different departments. So that's kind of how it kind of tapered off. But I still got an invite to her reception. Like it was like an Eid reception or something, and got to speak to her for a little bit. And yeah, it was amazing, surreal, like the best kind of experience and exposure I've had in my life. And again, that whole butterfly effect, like I couldn't have put this as like something I want to do. I just said yes to this opportunity. I applied for this opportunity, did it, and it came off the back of that, just right time, right place. But I wouldn't have known it. I couldn't have planned for it.
I honestly, I just want like everyone to just, like record that in their heads, because it's such an obvious example of sometimes, if the opportunity presents itself, just take it.
Yeah.
Because this is how I always think of it. It's like, okay, if nothing comes out of it, well, then you're in the same spot that you were in if you hadn't done anything. It doesn't matter. Like, you're not losing anything. You're always going to gain something. Even if you'd gone on this initiative, you'd used 2 weeks, you'd be like, okay, I met some interesting people, but that's it. You would have gained some new skills. So I think I just want to, like really push this home as well. Opportunities, when they come up, take them. Especially at dental school, I feel like we don't kind of value ourselves in the sense of, we've got that a decent level of intelligence where we're like, most people are quite driven, like make the effort to actually find things and do interesting things. But I'm just very happy to hear that, like you found something and it kind of like culminates in something really, really interesting.
Yeah.
You know what it is? It's the fact that you don't know who might be watching and who might be following you. Like, and that's not just this specific example. Like I've even been offered jobs off the back of just stuff that I've been posting on Instagram, and it's not. I didn't always go in with like, I'm just going to get a private job because I'm going to be posting on Instagram. Like if you scroll back on my feed, I was also doing crappy work on phantom heads, and like my composites are out of line, my crown preps are awful, but I was just putting them out there, and like people could see that this guy's got the attitude where like if I employ him, he's not going to be very good, or he's not going to be the best when he starts, but he will get there because he's going to listen to feedback that I give him, and he's got that mentality of like always wanting to improve and get better and better. And so that kind of person is a dream to have on your team, because their ears are open, they want to listen. They're not that kind of person who's like arrogant, thinks they're the best, and like just doesn't want to listen to any advice, because that's not what the kind of person you want to work or employ. And so it's just like, put your stuff out there, because even if you think it's rubbish, someone else might be looking at it from a very different point of view because they've got more experience than you. So just get your work out there, not just dentistry stuff. Say yes to opportunities, get involved with stuff, because you don't know where it might go.
Okay. Yeah, no, that's perfect. Okay, and then penultimate question. What tips would you give to those who need advice on how to maximize their potential in their DFT year?
Okay, DFT is very specific. So DFT is one of those really, the unfortunate thing about DFT is not everyone gets the same experience. They try and tell you that is going to happen, but it's just impossible to standardize. Like, think of it as a concept. All of these students coming out of dental school are being sent to random practices around the country, England, Scotland, Wales, wherever. And it's going to be impossible to try and make sure that everyone learns the same thing and develops at the same rate. And so that it's a little bit of a lottery. But there are some things that you should be aware of and you shouldn't be taken advantage of, because unfortunately, some of you guys do get stuck with principals and supervisors who take advantage of the fact that you're a foundation trainee. So the couple of things that you should be aware of and that you should push is, number one is time. So in DFT, you have got the license to take as long as you want. As long as you want. The business that you're working for does not suffer. The business that you're working for gets a fixed lump sum. Someone told me once it was 100 grand for the year, which I don't think is accurate, but it's ridiculous how much money they get to basically have you in the practice. So they've already got their money. You are not making them any money. You are there to just be trained, and they have obligations as part of being your trainers. So from my point of view is, you should book, and you should try and push to book enough time as you feel is necessary for you to do every procedure perfectly, to the best of your ability. Obviously it won't be perfect, but you should not be feeling rushed in DFT, especially not at the first 6 months. Like I get towards the end of the year, they want to try and train you up to work in the NHS. And so they kind of try and speed you up just for your own benefit so that you don't go into your first year associateship and you're like, oh my God, I can't deal with this. But at least for the first 6 months, like you should be able to dictate your appointment times, and you should tell them like, look, this is how much I think I need. And okay, what's the worst that's going to happen? You're going to be left with too much time and you might be twiddling your thumbs because you finished the procedure early. Great. It's much better than rushing something, messing it up, and then like not learning anything, feeling humiliated, knowing that you cut corners. That doesn't have any kind of benefit to you. Like, people often say, oh yeah, practice makes perfect. And I'm always like, no, like it's perfect practice that makes perfect. Like you need to do things. It's a bar, but I've heard it from somewhere else. Like
that's one of my favorite things to say.
It's a really good quote, because that is exactly what dentistry is. You cannot do amazing composites if you're not using rubber dam. Like you're not going to put cotton wool roll in there and you're not going to sculpt perfect occlusal anatomy. It's just not going to happen. I'm sorry. Like you can't cut corners and then expect to get the best results. Like you need to learn how to put rubber dam on. You need to learn how to put it on properly, because bad rubber dam is actually worse than no rubber dam. That's something that also people don't realize. And, I'm going off topic here, but point being, take enough time to do things properly, because that's how you learn. And you can do that in DFT. When you're an associate and you're self-employed, obviously how much work you do directly has an impact on how much you earn. And so you can't just take the mick and just spend the whole day with one patient, because the business will make a loss, you'll also make a loss, and it's not feasible. But in DFT, you get paid a fixed salary, so you don't need to worry about how much you're making, and the practice also gets paid, so you're not impacting them. So it's a win-win in theory.
Yeah.
So that's one thing to push. What's the other thing to push? The other thing in DFT really is just you have the time to expose yourself to lots of different influences. So your first boss has a big influence on you. So your ES, yes, they will be a big bearing on kind of how you view dentistry and what you implement. But they don't have to be the only person that you are learning from. Like they are going to be the everyday sort of person that's going to be there. But go and shadow clinicians. The learning doesn't stop in DFT. Loads of you are already on social media, but you can learn so much through Facebook and Instagram. And it's not Instagram dentistry, and it's not Facebook dentistry in a negative way. Like you can learn really good stuff off these places. You just need to be able to critically appraise it and also implement it in the right way. And ESs are good to bounce these ideas off because they have more experience than you. So one thing I find that a lot of King's graduates have, and I had this as well, which is that we have a bit of arrogance coming out of King's because we're taught that, oh, you guys know everything, and like you are at the forefront of like technology. And one thing I learned in foundation is that people older than you who have more experience than you, they may do things differently. And yes, some of those things may not be the way that you might do things, but it works and it holds value and you can still learn from it. Your dental career will be taking bits and pieces from different people, putting it together and implementing it. And so you can learn anything from everyone.
Excellent. And just our final question, which we like to ask our guests, just a quick one. Yeah. What is one tip you would give to people who are thinking of applying to dentistry at the moment?
One tip I would give to people thinking of applying to dentistry is not try and get work experience, try and get realistic work experience, if that makes sense. I think one thing I found, even as a grad, I did loads of work experience, but I never kind of got why dentistry was so fun and so good, because all my work experience was sitting in a corner watching someone do something that I didn't understand. It's a bugbear for a lot of people, I'm sure, but that it's impossible to be like, yeah, I want to do dentistry if you've never picked up a handpiece, you've never picked up something to carve, you've never like done an activity that is actually dental related, because watching someone do something like dentistry is the most boring thing you can think of. And so 100%. I'm not surprised that people don't want to do dentistry and they do medicine instead. Like dentistry is amazing. And I didn't know this until third year, until I picked up a handpiece and a scaler and I did like license to cut, phantom head stuff. Like I didn't realize how fun it was and how competitive it can be and how much you can see your work improve, and it's aesthetic and artistic and all this sort of stuff. People say it in interviews because they're taught to say it, but they don't actually experience it and they don't live it. And doing that as a student who's applying for dental school, if you actually experience that and you get that bug, you will shine at an interview 100%, because people will be able to see that you've actually experienced what it is like to be into dentistry. As to how you do that, there's lots of different ways.
Yeah, I think I'm just going to say one thing really, just to hammer this home. I always make this point whenever someone asks me, like, oh, how do I say the why dentistry? And it's like, if you just say you saw something, okay, you can say you've learned something, that's fine, but you can't really bring that passion up. You can't say seeing something is the reason why you wanted to commit like the rest of your 40, 50-year career to it. Because, for example, I sometimes see my plumber fix my sink, which I think is amazing, but that doesn't suddenly make me want to become a plumber. The same thing with dentistry. If you actually want to find out why you love it, you have to try and have some sort of practical hands-on thing. But yeah, as I said, it can be hard to get, but I think there's a few schemes out there, and I know that some universities do like some hands-on courses now. I think King's, and I'm pretty sure Queen Mary does them. So if you're in London, you're sorted. But yeah, anyway, take it away, Robbie.
That was a really insightful episode. Thank you so much, Zain, for coming on, taking your time, and we look forward to welcoming you on again for part 2. So thank you to all our listeners and viewers for tuning into the You Know the Drill podcast. Make sure to check out Zain's amazing Instagram page over at Dr. Zain Rizvi, and also London School of Dentistry, where they offer taster courses to people thinking of applying to dentistry. And on his page, you can keep up to date with his incredible work. Make sure to also check out our YouTube channel. Thanks for listening.
Yeah, and just to find out more about dentistry, the application process, and stay up to date with the podcast, you can also check us out at Spotify at You Know the Drill podcast, and at Farriston on YouTube for all your dental needs. Thank you for listening.
Peace out.